All right. Good evening, everybody. My name is Jake Leon. I'm the Director of Communications for the New Hampshire Department of Health and Human Services. I'm going to moderate tonight's webinar created by the Bureau of Developmental Services, which is titled Sharing What We Heard, Moving Forward Together. The purpose of the webinar is to share a summary of the themes and feedback that we at DHHS received during recent developmental services community listening sessions and surveys. On behalf of DHHS and BDS leadership, thank you for taking time to participate in these activities and for joining us tonight. I am joined by Lori Weaver, the Commissioner of the Department of Health and Human Services, Chris Santinello, Associate Commissioner at DHHS, who oversees long-term supports and services, Melissa Hardy, Director of the DHHS Division of Long-Term Supports and Services, and Jessica Gordon, the Chief of the Bureau of Developmental Services. And before I hand it over to Commissioner Weaver, I want to go through some housekeeping to help everybody who joined us today understand and navigate this webinar. Today's webinar is being supported with live captioning. To enable this feature, please click on the Show Captions icon at the bottom of your screen. Also, this webinar is being recorded. It's going to be posted on the DHHS website in the next day or two. That's important because given the anticipated size of the session tonight, we are using a webinar style. This means that attendees will be able to listen in only, in listen-only mode, and only presenters will be on camera. We're doing this to ensure that our primary presenters are visible clearly throughout the evening to everybody attending. While this webinar can support a large number of attendees, it does unfortunately have a capacity maximum. If we do reach capacity, the video will be posted on our website in the next day or two, because if at capacity, people will be unable to get in. It's a large capacity, so hopefully we're okay. But if it does come to that, it will be posted on the website, like I said, in the next day or two. And so if you know people who are unable to get in because of the capacity issues, we thank you for notifying them that they will be able to watch an archived version of the meeting once it is posted on our website. In fact, this webinar is one of several ways that tonight's information is being shared to support the interests of our community. To that end, we are providing you with the 2 QR codes on the screen, which will take you directly to ways to get in touch with us, as well as additional ways to reach BDS. A QR code is a quick way to access online information through your smartphone. If you want to participate in this now, simply open the camera on your smartphone and focus it on the barcode you see on the screen. Your phone will read this code, then provide you with a direct link in a yellow bubble. If you click on this yellow bubble, you will be brought directly to the link. We have also included the links in the underlined color font that you can click on once we move this presentation to our website in the next day or two. The first code connects you to a form where you can sign up for email updates on our progress in strengthening the system. This is the same form as we shared during the listening sessions. So if you've already signed up, you are all set up and do not need to sign up again. The second QR code will get you to a new web page that was developed to support individuals and families to more easily find resources and information about upcoming events and activities. Finally, your feedback and participation in our work is always encouraged and appreciated. We do anticipate having some time at the end today for audience questions. If you are interested in submitting a question, please enter them into the Q&A feature. I will read them to the panelists when we're concluded and they will address them. We do end promptly at 7 p.m. tonight. And so we do plan to respond to as many questions as possible related to today's topics. If we are unable to get to every question tonight, we will communicate that information to you all in the days ahead. So if you haven't already clicked on that QR code, please do so to sign up and to receive email updates. And with that, I will turn it over to Lori Weaver, Commissioner of the New Hampshire Department of Health and Human Services. Thank you all again for joining us tonight. Commissioner, the floor is yours.
Thank you, Jake. Good evening, everybody. As Jake mentioned, I'm Lori Weaver. I'm the current commissioner of the Department of Health and Human Services. I see that we have about 87, 88 going up, folks joining. I'm sure that number will go up as we go along. Thank you for coming out and joining us. I'm joined, I think Jake already mentioned the team. We have Chris Santinello, Melissa Hardy, and Jess Gorton with us here tonight. Wanted just to share with you what I would give an overview of what this webinar is about tonight. So since becoming commissioner about a year and a half ago, I've had the opportunity to speak with many of you regarding the DD system in New Hampshire. And I've also spent time with many of you discussing both pre and post the federally required changes in developmental services. And I know firsthand that these changes have not been easy. As significant as they were, I know it hasn't been an easy lift. I've also spent time listening to folks let me know what's important to them in the system. So one of the things I asked the BDS team to do last fall was to reach out to all of you, clients, family members, providers, area agencies, other stakeholders, to hear directly from you regarding your experiences, interests, and ideas. And tonight, we're going to share with you the feedback we received and how that particular feedback has informed our plans to strengthen the system. We look forward to sharing the summary of what we heard is most important to you and to lay out ways that you can get involved or stay involved as we move forward together. At DHHS, we do remain committed to community-based and family-centered services, and we value the critical role and contributions of families in supporting needs of their loved ones. We also want to honor the longstanding commitment of our area agencies and our providers to meeting the needs of individuals and families through their well-established services, local resources, and relationships. I've also seen firsthand the commitment, advocacy, and partnership across this community to preserve the strong community-based foundation that we have here in New Hampshire. And as we move through these changes this past year and a half, it's been quite clear how strong that community is. This foundation will continue to grow as we build on and strengthen the service system to ensure that the needs of each individual and family are met. So some key learnings to guide our future vision when we talked with various stakeholders, numerous stakeholders, we reviewed all of the feedback and all the themes that Jess and Melissa are going to share with you tonight. It was interesting to see the differences amongst the different groups, but also where they came together and common themes across all of the stakeholder groups. And there's 4 top themes that I just would like to share with you tonight. Communication, workforce investments was the second one. Third one was training and development. And the fourth one was access to services. Those were the top 4 that were across all stakeholders and also important priorities for the department. We are committed to working together with you to design the solutions and expand the partnerships to address these shared priorities. And it's basically your experience and expertise that's going to help us to find these outcomes and inform our work to achieve them. So again, thank you for coming out this evening. It's my sincere hope that we move forward together to establish a shared vision guided by the voice and individuals and families that we serve. So with that, I'd like to turn it over to Associate Commissioner Chris Santinello, who will talk about our intention to build upon the strong foundation of New Hampshire's developmental services system in order to strengthen the system for the future. Chris?
Great. Thank you, Commissioner. As the Commissioner said, my name is Chris Santinello, and I am proud to serve as one of the Associate Commissioners for the Department of Health and Human Services under Commissioner Weaver's leadership and alongside with the Bureau of Developmental Services team. For those of you that do not know me, I started my career fresh out of college 35 years ago. And I've got to say that number's a bit scary to say out loud publicly. Within the New Hampshire Developmental Services system, I started as a family support advocate. I never imagined that these experiences, relationships, and interactions would influence my life and career the way that it has. When I started, Laconia State School was still open and community-based services were only available to those residents who were leaving the institution. This same year, the New Hampshire legislature passed landmark family support legislation, recognizing the importance of families to the system. As a community, we worked hard together to develop local resources, build a community-based system of services and support, and also expand access to these community-based services to meet the needs of all individuals and families. This work shaped the New Hampshire Developmental Services System and built the foundation to ensure that everyone has equal choice and access to sustainable, quality services statewide that are really focused on each individual and, in many instances, their families' personally defined outcomes. When I look to our history, I am reminded as to how far we have come, yet I also see how far we still can go together. With each of you, we will continue to put the person and family at the center. We will also make sure that people know where to go for assistance, have a better understanding of what is new and what remains very much the same, have the same access and opportunities no matter where they live in New Hampshire, and also have opportunities to get involved if they so choose. It is also important as we go forward that we focus our work and communications on strengthening the service delivery system. We heard you loud and clear that the terms transformation or system change sound as if we're moving away from the system and supports we know and trust. We agree with you, and language does matter, which is why we are focusing on strengthening the system. It remains our commitment to build on what has made and what will continue to make the New Hampshire Developmental Services System strong and recognized nationally for our local, family, and consumer-driven community network of supports. I would now like to introduce Melissa Hardy, who's the Director of the Division of Long-Term Supports and Services, who will walk you through the listening sessions recently held by the department. Melissa?
Thank you, Chris. So like Chris said, my name is Melissa Hardy. I'm the Division Director here for the Long-Term Supports and Services Division. One of the bureaus that I oversee is the Bureau of Developmental Services. Over the past 2 years, I've had the privilege of working closely with many of you that are attending on the call, and of course, the team here at the Bureau. And I look forward to more opportunities to listen. Through our most recent listening sessions and surveys, we received such valuable input and collaborative feedback. I appreciate your willingness and advocacy to share your ideas with us and often your very personal experiences. As the Commissioner and Chris shared, your input will guide our shared vision to work together to strengthen our developmental services system. To summarize the approach we took to collecting this input, we coordinated 8 dedicated listening sessions as well as individualized surveys for each of the different stakeholder groups. These stakeholder groups included families and individuals served by the developmental system, area agencies, our service providers, and support coordinators. We took this approach as we anticipated that there will be many different priorities, perspectives, and experiences, and we wanted to make sure that we had space for everyone to share openly. For all stakeholders, our listening sessions were generally focused on what is working well and what we want to preserve as a system, which areas could be working better and improved upon, and what topics and resources people wanted to learn more about. We also listened to open feedback and comments broadly during these sessions. So specific to the listening sessions, you can see we had over 380 people participate. We had 5 individual and family sessions that included 3 in-person sessions and 2 virtual sessions. We held 1 service provider listening session, a service coordinator listening session, and an area agency listening session. So in addition to these sessions, we encouraged all to participate in the surveys as another way to share information, both for attendees of the listening sessions, but also for people who were unable to attend. From these surveys, we received over 360 responses, with 242 from individuals and families, 25 from service providers, 20 from service coordinators, and 73 from area agency staff. Next slide, Jess. Thank you. So looking at our shared priorities, as you heard from Commissioner Weaver, the top priorities shared across all stakeholders include communication, workforce investments, training and development, and access to services. We arrived at these priorities by reviewing all of the survey responses and through the discussions in the listening sessions. The feedback you provided and continue to provide helps us carry out our mission to join communities and families and providing opportunities for citizens to achieve health and independence. I want to personally thank you for taking the time to provide us your feedback and for joining us this evening. And I look forward to continuing our partnership. I'm now going to pass the presentation to Jess Gorton to talk about some of the key learnings and themes from our stakeholder feedback groups and how these will shape our path forward. Jess?
Thanks, Melissa. Good evening, everyone, and thank you for joining us tonight. My name is Jessica Gorton. I'm the Bureau Chief here at the Bureau of Developmental Services, and I'm incredibly excited to share this information with you all. As Jake mentioned earlier, this webinar is one of many ways that we are planning to connect with you all, both about this information that we're sharing tonight, but also to keep in touch, keep hearing voices, keep sharing information back and forth together. One other thing too, I am going to try and promise really hard not to fall into the alphabet soup trap and use a lot of acronyms. My hope is that on the presentation, and I know that on the presentation, excuse me, these are defined, and I'm going to try my best, but anyone on my team, on our team here in the webinar, please don't hesitate to either define out an acronym if I use it in the Q&A for folks, or, just stop me and say, hey, Jess, please go over what that means for the group. So with that, the first group of information that I'm hoping to go over with you all is their key learnings from our individuals and families. There, we saw there was a focus in the areas of participant-directed and managed services, caregiver supports, and future planning, and then housing. And as we discuss these areas on the right-hand side of the slide, we've also shared some of the specific comments that we received in these areas, just to help contextualize it a little bit for you all as you're going through when we're talking about some of these topic areas. So first, if we look at participant-directed and managed services, individuals and families shared that they are seeking transparency, flexibility, and control within budgeting and program options. For example, some folks asked that we provide a template option or a template of options of what participant-directed and managed services programs look like, so that we have a sense of what we can prepare for, and also that a list of all services available for participant-directed and managed services so that we can have all of the appropriate information. Great ideas, great feedback that we're working through right now. In the area of caregiver supports and future planning, there are requests for support and resources for future planning and transitioning to adult services. For example, folks asked what options are available as we reach an age where we need more help caring for our children with disabilities as they reach a more mature part of their lives, and just that general request for future planning for people with disabilities. In addition, we also heard a request for accessible and affordable housing options, and that these were a priority for individuals, families, and their support staff. Feedback dove into areas such as providing more models for residential options that are appropriate and would free caregivers to provide support and still be productive members of society. And there was also a recommendation to develop a more long-term housing option for the adult IDD population. Next slide, please. The next group of folks that we talked to, our area agencies, service providers, and service coordinators identified 3 additional priorities, which would include person-centered practices and planning, rates and funding, and system efficiency and stability. In the area of person-centered planning and practices, tailoring services around individual needs and aspirations with a focus on person-centered approaches. People emphasize continued focus on the individual, not the system, and team approaches to providing support services, establishing a collaborative approach to designing a support program. Additionally, this group identified developing sustainable funding models and fair rate structures to better support individuals in New Hampshire. Feedback including requests to increase rates so that staff can be paid better, and that individuals and families should have a clear understanding of how their services are funding. We also received a great deal of feedback around in the area of reducing administrative burden on developmental services staff, identifying redundancy in processes, and standardizing practices, to allow more time for person-centered service planning. For example, requests to create consistency in systems across the state, ensuring that we have lean, simple, and streamlined processes, and that we minimize redundancy. Next slide, please, Jess. Thank you. So now, as we look at those areas from our different groups and identify what those shared priorities are, as the Commissioner Weaver and Director Hardy both pointed to, we were able to focus on 4 shared priorities: communication, workforce investments, training and development, and access to services. There was collective emphasis on the importance of clear, open, and transparent communication. Individuals and families are seeking increased communication and updates regarding changes and better understanding the roles of various entities, such as the Bureau of Developmental Services, area agencies, service providers, and service coordinators. With some respondents asking for regular communication with families about changes BDS is making that directly impact families. In addition, area agencies, service coordinators, and service providers identified the need for enhanced communication between each other and with the Bureau of Developmental Services for improved efficiency and service delivery. More communication between BDS, area agencies, and families, and reoccurring meetings with BDS and stakeholders. Our stakeholders in our community also advocated strongly for increased wages to address workforce shortages for direct support professionals and for service coordinators. Individuals and families supported wage increases to attract and retain staff, and our area agencies, service coordinators, and service providers sought wage increases to retain staff and improve their quality of life. The comments reflected the need for reasonable pay wages with room for increases comparable to other employment opportunities, and also development of statewide initiatives to recruit direct support professionals. In addition, stakeholders identified the need for robust onboarding training for new staff and ongoing professional development for existing staff, and training opportunities for individuals and families also being a high priority. Individuals and families seek training and resources in plain language to navigate waiver services and participant-directed and managed services budgeting, for example. Doing trainings, recording webinars, and giving specifics and overviews was offered by one individual. Area agencies, service providers, and service coordinators also requested resources to support new staff and advance career development, with feedback pointing to more training surrounding respect and understanding the family unit and how it enhances the life of the people that we serve. Lastly, stakeholders stress the importance of accessible and regionally available resources and services. Individuals and families were seeking strategies to expand services, reduce wait times, access to respite services, and gain support in navigating available services. One idea shared was that BDS should discuss building a universal, comprehensive, and plain language list of all available services. Area agencies, service providers, and service coordinators expressed a desire for flexibility in service delivery in a comprehensive developmental disabilities waiver 101 guide, for example, for new staff and families, and increased community involvement opportunities. So with all of that information, we wanted to share what opportunities we'll have and what's coming next. Considering this feedback, there are several areas where we will increase our current activities or jump into some new activities pretty quickly. In response to your ask for increased communication and information, I'm pleased to share that we have recently developed a dedicated individual and family resource page. Jake showed the QR code for that earlier. I believe a link was dropped into the Q&A so that folks can access that. And when we add this presentation to the new website, folks will be able to get in there and navigate through some of those additional resources too. On the next slide as well, we'll share how to access this page through QR code again. One thing to keep in mind, because this is newly developed, we'll be working with our communications committee and some other stakeholders to best organize this with current resources and really make sure that it's a one-stop, easy to find web page that has tools and information for everyone. Also in this area, I look forward to developing ongoing community forums as another way to bring you important updates and connect with you to get your feedback and ideas. In the area of workforce investments, we will prioritize the development of the developmental disabilities waiver rates with the continued collaboration and support of our rate work group members. The goal of these new rates will be to put the wages of the direct support professional at the core to help address the workforce challenges and to promote access to quality services. In response to your feedback around participant-directed and managed services and your request for additional information and resources, we're working to bring in national expertise, and they're seeking their assistance to consider options and best practices that will build on our shared goal for successful and supported participant-directed services. We recognize and appreciate the role and responsibilities of individuals, their families, in our area agencies and self-directed services, and want to continue to promote this opportunity for individuals. And then in the area of access to services, training, and resources, as a community, we want to ensure that we are guided by person-centered service planning. To support this, we've been working with national subject matter experts to develop new resources, content, and training for our developmental services community. We're appreciative of the participation and contributions that many of you have already provided, and we'll continue to prioritize these efforts to strengthen our shared commitment to person-centered practices and access to resources. So again, thank you all for providing your feedback so far. It's been very helpful as we continue to move forward and work with you all on our system strengthening work. We hope to continue to connect with you and to continue to have this information as we take a look at what's next. And we want to re-emphasize that we're always open to your feedback. On this slide, if you're able to utilize the QR function, the QR code function, it'll bring you right to the link to the new webpage on the Bureau of Developmental Services website. This is where you'll find today's presentation posted. We hope to have that up later this evening or possibly first thing tomorrow. And in addition, this will be recorded so that folks who weren't able to join us tonight can hop on and take a look and see some of this information as well as review the slides. As I mentioned, we'll continue to develop this page for you, and we appreciate your feedback and the feedback of our communications committee. They have been ongoing supporters in recommending our efforts in increasing access to information and bringing that to you all. Also, towards the bottom of that webpage, if you go on there, there's also a yellow button titled Your Voice Matters, which you can click and it will redirect you to a fillable forum where you can share feedback directly with the Bureau of Developmental Services. Also, at the bottom of the webpage, you'll notice that we have, sorry, when I look over here, I'm looking at the webpage, I have it up next to me. You can provide information via phone or email address too, if that's a preferred method of communication. You know, we really want to make sure that we're meeting folks where they are in their preferred ways of both accessing information and in sharing information with the Bureau. And now I'm going to turn the mic back over to Jake to facilitate questions that have been entered into the Q&A function.
Thank you, Jessica. And we do have time for questions if anybody's willing to type in their questions. We've got 2 in the queue, and I'm going to just read them and ask that my colleagues who are experts in this jump on what it is that they know, if they can answer. First question is, as an FYI, the manual is being worked on for ESS currently, and then PDMS should outline the various ways PDMS can work. Thank you for that, Kathy S. And then also a point, same individual made a point, perhaps someone wants to speak to that. Oh, okay. Actually, Jessica Kennedy, I think is here, would like to answer that question or respond to Kathy's comment, that FYI. Are you going to do that in type? You're going to type that in? Sorry, this is all a little too newfangled for me.
That's okay, Jake. And while Jess is maybe adding a little bit of information into the chat, thank you, Kathy. We are working and we have had our participant directed and managed services committee has been working host.
Okay, we're back on. Yep.
Yeah, has dropped. So now we've got it back up.
Okay. Thank you, Jess. And then Kathy made this also made a point. DSPs also need benefits, health insurance, paid with low premiums, sick time, vacation time, etc., particularly PDMF's staff employed by families.
Thank you, Kathy. Yeah, I'll jump on that, Jake. 100%, Kathy, and through the advocacy of the rate work group and the focus of how the rates are being developed, looking at the wage being at the kind of the base to build upon, but also looking at some of those benefits as well to add in and how that all builds up, so to speak, to a full rate. So wages, benefits, time off, health insurance, all of those things. The goal is for all of those things to be included in those new rates that are being developed.
Thanks, Jess. And Wendy Garvey asks, can someone elaborate on the program of last resort where we can obtain information as to why this was stopped? I don't know if anyone can address that.
So it's a little bit outside of today's focus area, but what I believe that you said that was Wendy that asked that question.
Yes, yes.
So at one point in time, as we were talking with our community and looking at some of our corrective action and conflict-free case management requirements, some information was shared from the community about this very topic. And as a result, last November, we were able to, in collaboration and through approval with our federal partners at the Centers for Medicare and Medicaid Services, I want to mention that too, update our policy that was kind of causing the little bit of a some of those concerns that Wendy's bringing up. And I think we're happy to maybe dive into that in another forum too, or just talk to folks as well if there's still any questions or concerns from the community about what that means and what that looks like going forward. Is a little different. I'll give you that. But I think some of those some of the concerns that were raised by the community previously around that functionality, we've attempted to address that and hopefully in collaboration with our area agencies and through their advocacy too, we're able to land on some changes that helped.
Thank you. Okay, next question comes from, sorry, scrolling, Karen Hatch. Oh, sorry, we're going to come back to that one. It's a multi-part, forgive me. Next question comes from Maria Badeau. Can we expect any initiatives from BDS on improving the access to services, availability of services, and collaboration in regard to housing challenges for our IDD, ABD population?
Thank you, Mariah. Yes, these are areas that were identified really strongly by the stakeholders as we participated in our listening sessions and evaluating the survey results. So at this point, as we move forward and as we jump into some areas that we can really outline steps that BDS is taking, either areas that we're leading, such as rate development and how that might directly impact individuals accessing services through our developmental services system, or areas where we can be a partner to other agencies, either within the Department of Health and Human Services or also collaborations with other entities that are also looking to address some of these issues that are going on across New Hampshire and also across the nation as well.
Thank you, Jessica. All right, and sorry about that. I got a little overwhelmed by the three-part, although it's very clear. No need for that. So returning to Karen Hatch's question, first of all, and thank you for this, Karen. Thank you for the informative presentation. She has a few quick questions. How will, and I'll ask them individually and to give you all a chance to respond, and then I'll move on to the next question once we've cleared it. How will BDS address the issues of the reimbursement model specifically related to families who are not in a position to pay up front and wait for an extended time for reimbursement moving forward into the next biennium, especially for families requesting funds via family support? And, I don't know, some of these might, benefit from briefly touching on them, but then if we need to follow up with folks, these are pretty involved questions, and I want to do them justice, whether that's now or tomorrow or later today or tomorrow in writing. But go ahead and get started. If somebody who's
Thanks,
wants
Jake.
to pick that up.
Yeah, I can take a first step at this, and then Jess, if you want to chime in. We have certainly addressed the family support question here with area agencies individually as far as the reimbursement. So I would say, that's an ongoing conversation with your area
being interpreted as recreational, utilizing general funds when completing ISA specifically for families relied upon to build their loved ones' day programs under the PDMS model. These activities are no longer being covered
involved with, there's legislation that's currently being heard as far as it relates to recreational funding. So that will address some of your question, Karen. I do think there's been no decision made as far as a line item in the budget for the next biennium, but we will keep everyone informed as those decisions are made moving forward.
Thanks, Melissa. And then the next question is, will families be able to flexibly move funding around to areas of need in their service delivery plan? And how will this be done efficiently and timely?
So Karen, I think and also hi Karen, I think you might be asking this in the context of participant directed and managed services or in-home supports, both of those being self-directed. And we want to make sure that we are encouraging and continuing to encourage that flexibility for budget oversight within a PDMS or participant directed and managed services funding model. So that is, as we really talked to the community and heard and kept in mind what's working well and what are the things that people want to either enhance or strengthen, that came through loud and clear as an area that folks wanted to preserve. So as we bring in that national expertise and that technical assistance, we want to make sure to keep that at the front of the conversation, preserving what's working well and what families really think supports them and their loved ones and participating in services, and taking a look at some of the areas that could benefit from either some updates and best practices or even options that are out there that we didn't, perhaps even know existed and that we would want to take advantage of within New Hampshire.
Thank you, Jess. Our next question comes from Kelly Earhart, who asks what we are doing about dual diagnoses.
Hi, Kelly, welcome. So continuing to work in collaboration with our community mental health centers and our Bureau of Mental Health Services, and just taking a look, we know that there are some pockets in the state who have developed or demonstrated some significant expertise in this area. And what we really want to do is take a look and understand, what are the supports that are in place? How are these structures working so well? And what are our opportunities in moving forward? This was also brought up fairly consistently through different stakeholders in the listening sessions. And, it's been identified as a key area for all of us to take a look and see what we have available and how do we strengthen this across the state.
Thanks, Jess. Next question is Wendy Garvey asks, with regards to rate development, where are we at as a system with PDMS being paid as a separate entity as they should with the Department of Labor, thus allowing the availability of additional staffing opportunities for our consumers?
So sorry, Jake, I'm trying to kind of just break this down to understand the question a bit more.
Yeah, take your time.
So what I can kind of say through it is participant directed and service and managed services, being that it's a method of service delivery, the base service itself would also be included in the rate development work. I'm trying to see though, as we separate the entities, they should with. So I think generally speaking, as we look at rates and understanding the connection between rates and recruitment and retention of staff, we also recognize that within the realm of participant and directed and managed services, that families have shared that in accessing or onboarding or keeping a family managed employee, these same considerations exist. So the hope is that the rate work will increase this for providers as well as for families trying to onboard family managed employees. And I hope I'm answering that question thoroughly, Wendy. If not, certainly happy to connect.
Please reach out.
Yeah.
Yep. Sorry to interrupt, but yes, perfect. Thank you. And then Kathy is next question builds off of Karen's earlier question. Why are FSCs no longer getting their allocated funds for them to disseminate, as has been the process? There's too much documentation now and families have to wait and front funds. Melissa, could you address that?
Yeah, so thank you, Kathy, for the question. So FSC is Family Support Council, as most people know, but again, kind of building off of Karen's question, nothing has particularly changed in the allocation of those funding. And so, Kathy, certainly happy to discuss, the too much documentation and family having to wait in front funds. That's certainly not what our purpose or aim for that allocation is. So certainly if that is something that is concerning, please, you know how to reach out to us. And certainly we've had these conversations with each area agency as they've come up. So please reach out, and certainly that is not the intention of the funding for Family Support Council dollars.
Thank you, Melissa. Okay, I have no more questions in the queue. For those of us who've joined us this evening, there is a little more time if you have any questions. Otherwise, we're happy to give you a few minutes of your evening back. Well, thank you all so much for joining us tonight. I hope you found it as informative as I did. And I hope you'll take a moment to to jot down information, the phone number and email, how to reach BDS. Again, the presentation, the PowerPoint presentation that we walked you through this evening will be posted on the website. I expect it's going to be, first thing tomorrow morning, and then the video, once it's ready, it takes a little more time. Then the presentation, we'll get that posted hopefully by tomorrow. If not, I'm sure the day after.
Jake, I do see one question, or I think something that we could address pretty quickly in the chat there.
Yep, I see one. Before we get to Danielle's question, Loretta asked if we could put the QR code back up. Jess, could you do that while we're addressing Danielle's question? And then Danielle asks, thank you very much. Loretta, the QR codes are back on the screen. Danielle asks, who sits on the committees or work groups working on the top 4 needs specified by stakeholders? Are parents able to sit in on any of these groups? If so, what is the process?
Thank you for that question, Danielle. And we are really excited to look at the different rate or groups and structures that we have right now. We heard loud and clear throughout all of the stakeholder engagement from more families and individuals who wanted to find different and meaningful ways to participate in both identifying some of these priorities, but also once these priorities were identified, how do we move forward together to talk about how we get to some of these. So we will be coming back with more information and more opportunities and ways for people to become involved, likely some more focus groups and focus sessions. We had a great question thrown out to us a couple of months ago that was just really, hey, how do we get to folks who maybe don't have the ability to participate in monthly work groups and other ways, and talking to other families and hearing some feedback. Ideas were given out, such as specific focus groups, time specific, so that people can hop in, especially in areas that they're particularly passionate about or really, want to be a part of and make their voices heard. So I'll be connecting very soon with our communications group to brainstorm a few of these ideas and these ways, and that people can get involved. And we hope to have that information available to you all in, the coming weeks.
Thank you, Jess. And we do have one, there's another question or two from Wendy that are popping up. But before I get to that, I just want to note to everybody that Jess Kennedy shared again the individual and family information and resources, the links to that page, as well as how to provide feedback. All right, I'll take these individually. One question is, what is being done for inflated PDMS budgets regarding wages, i.e. benefits that are not being utilized?
So I think right now within our service system, and one thing that was shared that we've all observed as well, the workforce shortage and the impacts that it's had on folks being able to access those services, certainly when they've identified a specific need, and if there's a inability to obtain that staff, with some of those funds in their budget not being tapped into or accessed. I don't think there's a goal or an emphasis on reducing services as a result of that, or reducing funding for services as a result of that. Really, our goal and what we want to look at is how do we retain and onboard and attract folks to work within our developmental services system in New Hampshire, and even to move to New Hampshire and consider coming to our great state and being direct service providers or family managed employees. So us taking a look at some of those mechanisms or some of those tools we have in our toolkit to really ensure that we have that robust provider network to offer the services is where we're focusing our efforts. And not on, reducing services or the funding for services.
Okay. And I think Wendy's next question was related to that. So I don't know if you feel like you addressed it, Jess, but just to make sure everybody hears it, she follows up related to that question. Where does that money go? When is not utilized for intended purpose, i.e. 40% for benefits, but not utilized? Feel like anything more do you want to add to that, Jess? Wendy, I just wanted to make sure everybody heard the second part of that question.
I think what is unique for developmental services is that we have a dedicated fund. So those funds remain in that dedicated fund year over year.
Thank you. All right. Okay, well, thank you all for joining us this evening. Like I said, the PowerPoint presentation will be up on the website shortly by tomorrow morning at the latest, and then the video as soon as it's ready, hopefully tomorrow as well, if not on Friday. Ways to get in touch, ways to make sure this information is shared widely. We've given you that information. We certainly thank you very much for taking time out of your busy evening to spend this time with us. We hope you found it informative, and we appreciate everything that you do for the families and individuals that we serve. Thank you all so much, and have a wonderful evening.
Bye, everyone. Good night.
Right.